NCD civil society is coming together in Kigali, Rwanda to exchange knowledge, share good practice and strengthen capacity to advocate for prevention and control of NCDs. The forum will provide the platform to strategize, coordinate and unite ahead of the UN high-level meeting on NCDs in 2025 to ensure it brings about a meaningful change for people living with NCDs. The forum is possible thanks to our strategic partnerships and will be convened together with Rwanda NCD Alliance in collaboration with the Rwanda Ministry of Health and Rwanda Biomedical Center. Thanks to our supporters who have contributed to making the Global NCD Alliance Forum a reality.
Well, good morning, everyone. You're a bit quieter than yesterday afternoon. Good morning. Great. Well, I really hope that you enjoyed the party last night. Yeah. I can't promise any dancing up here now, like last night, but I can hopefully give you some lively debate and some information, some entertainment from our fantastic panel who are going to be talking about leadership in NCDs. My name is Jackie Thornton. I'm a health journalist for The Lancet, BMJ, and Nature in the UK, and I'll be moderating our panel discussion. So we're here for this session, 2025 and beyond, leadership in NCDs from grassroots to government. We're here to inspire current and future leaders to take the bold actions that are needed. You know, we've heard about the challenges. We want to tackle NCDs to advance policies and solutions that can be successfully implemented to promote health, to save lives, and to protect people's rights. Now, as the title suggests, we are talking about leaders from all levels, equally important, global, national, and grassroots. We want to showcase the effective strategies that leaders are using at all of these levels to change priorities. Now, as you know, it's been mentioned before, it's a pivotal time ahead of the UN high-level meeting in September. It's also a concerning time given the freezing of US aid. So I'm shortly going to introduce our really stellar panel. But in the meantime, I want to basically introduce a video. Before I do that, I want you to be involved as well, the audience. So please do tweet on social media or Blue Sky or whatever, and make sure you use the hashtag #ActOnNCDs, hashtag NCDAF 2025. Also, you can mention and tag the NCD Alliance so we can look out for it. So, without further ado, I'm going to introduce a video from Dr. Jerome Solomon, the WHO Director General of Universal Health Coverage and Communicable and Non-Communicable Diseases. Thank you.
Excellencies, honorable ministers, distinguished guests, dear colleagues and friends. World Health Organization is honored to participate and contribute to the 4th Global NCD Alliance Forum. Your engagement in this forum reflects a commitment to ensuring that all voices are heard in shaping impactful policies and solutions. Since 2011, 3 United Nations high-level meetings on NCDs have fostered political commitments leading to national strategies, strengthened regulations, and increased partner engagement. However, many people living with or at risk of NCDs still lack access to affordable, quality, and life-saving medicines and technologies for effective screening, diagnosis, prevention, treatment, rehabilitation, and palliation. Vulnerable populations face heightened risks due to global challenges such as conflict, displacement, and climate change. The fourth UN high-level meeting on NCDs in September this year is an opportunity to drive significant progress through an ambitious and transformative political declaration. There is still much to be done, strengthening governance, working better with partners across and beyond the health sectors, enhancing financial protection, regulating harmful commercial practices, strengthening monitoring, and improving access to medicines and technologies, while meaningfully engaging people living with NCDs and mental health conditions, and through a primary health care and universal health coverage approach. We count on your support and continued partnership and wish you a productive and successful meeting. Thank you.
Well, thank you very much to him. Now, we want to introduce our panel to come to the stage. First of all, from the Seychelles, we have Dr. Anne Gabriel. Anne used to be the former Chief Medical Officer in the Seychelles, and she's now championing the results-based management system, which sits within the Minister of Health's office. So welcome to you. Thank you very much for coming. We also have Guy Fones, who is a medical doctor by background from Chile, but you'll know him as Acting Director in the Department of NCDs and Acting Director Global NCD Platform for the World Health Organization in Geneva. So thank you, Guy, for coming. Also, somebody well known to you will be Patricia Lambert, Chair of the Global Alliance for Tobacco Control, formerly Director of the International Legal Consortium from the Campaign for Tobacco-Free Kids. In Washington, Patricia, by background, is a human rights lawyer, so I'm not going to get into an argument with you, Patricia. We also have Padmaja Kumari Palmer, who is founder of Friends of Mewar, a Boston-based philanthropic organisation supporting the implementation of preventive healthcare in urban and rural Rajasthan in India. So welcome, Padmaja, to you. We also have Ferdi Sonnier, Executive Director, a new title, for the Africa NCD Network, and also Secretary General of the Cameroon Civil Society NCD Alliance. Welcome to you, Ferdinand. If we had a meeting about leaders, we cannot not have Katie Dane, Chief Executive Officer of the NCD Alliance. So welcome to you, Katie, back to the stage. So obviously we're going to be reflecting on our progress with NCDs over recent years, the challenges that these leaders are still facing, examples of positive leadership, and what the leaders need to know and do ahead of this high-level meeting. So I want to come to Guy first. Guy, I want to look at the big picture. You know, what do you see as the biggest challenges currently in this global fight against NCDs leading up to the high-level meeting? And how can we all work together to overcome the challenges?
Thanks.
In 2 minutes, Guy. I mean, you know.
Let's dive right into it.
Yeah.
Thanks for the question. And good morning, everyone. It's really a pleasure to be here. Thanks, Jackie, for inviting us to the stage. ADG Salomon, WHO's Assistant Director General, you just heard, I think pretty much outlined it very, very well. But if we have to focus on the main challenge, it has to be, Jackie, this chronic underinvestment in health services that address NCDs and mental health program services and interventions. This chronic underinvestment, and it has to definitely do with sustainable financing to ensure these services are available. The lack of chronic financing for these services has left millions of people unprotected, undiagnosed, untreated, uncontrolled. It's really a critical situation, and I'm really, it's really interesting, and I congratulate NCD Alliance and the sponsors that have identified these three pillars during this forum. It's really about sustainable financing, supported by very strong leadership at all levels, and then underpinned by community engagement. So it is the focus on sustainable financing, which will make a difference as we move into the fourth high-level meeting. The good news, Jackie, that is we have some solutions, we have some guidance. I know we have not been, we have definitely prioritized this discussion, and I'm happy to share, many of you may have already seen it, we've just launched 2 policy briefs that are a very important distillation of a multi-stakeholder, multi-sectoral convening last year at the International Dialogue on Sustainable Financing for NCDs and Mental Health. That the distillation of those discussions, of the inputs from different stakeholder groups, the call for clear, high-level leadership and commitment for sustainable financing has come together in these two policy briefs. Very important, which really point to where will the money come from, the first of the policy briefs, and then making the money work better. I think this is exactly what countries need to know, exactly what high-level policy makers and leaders and heads of state need to commit to, with strong commitments and strong accountability frameworks to ensure those are delivered and sustained.
So are you talking about increased domestic funding, sustainable? I mean, how can hard-pressed governments, who've got many obviously challenges themselves, what will persuade them that actually sustainable financing internally is the way forward?
Well, I think it is already persuading many, and many heads of state are already taking action. As you say, the first one is where will money come from? Definitely, we have to enhance domestic fiscal space, and health taxes is the way to go. And I think there are many examples. I think Rwanda, I congratulate Rwanda for being one of the champions in addressing the need to enhance health taxes and use those health taxes for enhanced fiscal space. Hopefully, much of that going to health and NCDs, much needed. But there are great examples of where that's happening. And then also on how to use current fiscal space more efficiently, great examples, very good, clear actions in that policy brief that we will support. We'll support that commitment and that action.
Okay, thank you. We've got other sessions. We've got sessions later today on sustainable financing, so we'll hear more about that then in detail. But let me come to Anne. Anne, Seychelles has made some really positive actions and responses. And being a small island nation, I'd be interested to hear what you've been doing. What have been the challenges that you've specifically have been facing? What have been the lessons that you've learned and the strategies that you've put in place?
Thank you, Jackie. We could go on and on talking about small island developing states and our challenges, but I will just address only 3 challenges: lifestyles, policy implementation, and limited resources. For example, in Seychelles, we only have a population of 120,000. So therefore, you only have a limited number of people to actually even implement your policy. What happened with the small islands is that over the years, we managed to develop economically. We have high literacy rates, we have robust health systems, and we expected this to bring about healthier lifestyles for our population, but this was not going to be the case. Instead of our nations being healthier, now we do have NCDs dominating our landscape. So if you just name it, diabetes, hypertension, cardiovascular disease, obesity, we have it. Then we have the stress and the mental health issues, we have those. We have an aging population and all the complications coming with them, we have those. Our budgets have to go into the complications of NCDs, like hemodialysis, and care for the very sick. And even we invest in overseas treatment. In over 10% of our budgets are going into treating complications of NCDs. The Seychelles is not alone, but we have put together some very strategic actions for us to deal with these situations. Advocacy is very important, and for advocacy you need data. So we have to generate data and get the evidence. And in Seychelles, we conducted 5 surveys between 1989 and 2023. But these eye-openers were disappointing in a way, because since 1989 to 2003, our obesity rates rose from 18% to 45%. Wow. So what do you do in these situations? So you have to use the evidence to put in policy changes. We just had to be bold. We had we banned tobacco we had the FCTC convention. We banned tobacco indoors. We ban public advertising on certain foods, on alcohol. We've limited the number of hours whereby we can sell alcohol. But most importantly, we have included the other sectors. They have to be our collaborators. You have to have your enemy close to you. The private sector is very powerful. The private sector influences policy. The private sector has power, and governments need the private sector even to stay in power. So even our public health policies are being challenged in view of the powerful private sector. So you have to have the evidence to constantly advocate to the government, and you need the private sector to work with you. So they are on all our committees, and as well as civil society. Government subsidizes civil society, appoints a CEO, subsidizes the umbrella body, assists the NGOs in implementing their policies and strategies.
Yeah. That sounds really fascinating, that what's going on there, and given that backdrop of that huge rise in obesity. But I think you also mentioned to me earlier about the pooled medicine program, because obviously you have a challenge accessing medicines to combat NCDs. Tell us a little bit about that briefly.
Sorry. We have implemented WHO strategies. They are very clear. There are about 100 of these evidence-based strategies that WHO has put up. And one of them is the SAPEN. So we screen everyone coming to a health facility, and we offer them treatment. The limitation is that it's not yet community level, so we are getting people at our health facility level. But on a bigger scale, food labeling has been a challenge, but we insist on having all food labels, foods labeled on the front of the pack. And we target schools as well, schools for interventions.
Okay. Thank you very much indeed, Anne. And turning to Patricia, I mean, I think obviously we've talked about collaboration there between the private sector. You've been fighting against certain aspects of the private sector for many years. But I wanted to ask you, you've worked on both sides, government and civil society. And civil society, as we know, is a key driver of change. We can see it here in the audience. How do you think the civil society can be empowered to bridge this gap between policy and action? We've heard from Anna that there is this gap between policy and implementation in some respects. What can civil society do?
From my perspective, if you have political will, you then need passionate advocacy to work alongside that in order to achieve action and realistic change. And it doesn't only happen at the point of passing a new law or putting a new program into government. It is very much a day-to-day thing, especially for non-communicable diseases. I like to think of it as concentric circles. If you were to throw a small stone into a still pond, you would watch the concentric circles move outwards. That's only half of the picture. When it comes to passionate advocacy from civil society, that needs to go out from the individual to the local level, to the community level, all the way through to the global level, and then it needs to come back in again. And so the high-level meeting and forums like this are a chance to go from the global level in, and when you're in your home country, it's from that passionate advocacy as an individual in the community and so on.
Excellent. Okay, well, that's a really good point. But let me come to some others who are very practiced in that type of advocacy that you talk about. Let me come to Ferdinand. Ferdinand, tell me about how civil society is making a difference in bridging that gap that we mentioned earlier.
Yeah, thank you. I think one of the key things to understand about civil society is really their role. And I've had like such a very, very, very honored feeling about being a civil society advocate by seeing practically this role happen since when I started working on NCDs. And civil society really advocates. That means we're not the decision makers, but we do influence the decision makers significantly. We influence from the place of a lot of technical knowledge, a lot of understanding, lived experience of what really it means in terms of the need to bridge that gap between policy and implementation. And we do work also a lot in terms of bringing access. There are so many different civil society organizations, even faith-based organizations, that bring care, that bring information to the masses in great numbers, and to even, political leaders like we've mentioned. So civil society plays that very important role, and you can see that example burgeoning in Africa. The kind of civil society work you find in Africa, especially on NCDs, is just amazing. Country level NCD alliances, which combination of civil society organizations. Then you see that burgeoning into Africa level combination of civil society organizations, breathing and causing attention on NCDs. That's something that is very important, and it's really going to be helpful to bridge that gap.
Badmarsha, let me come to you with the same point. And we've heard about the importance of lived experience, and I mentioned earlier in my introduction, you live with type 1 diabetes. But in terms of how the voices of civil society, Ferdy says about informing, but getting the leaders to understand, the political leaders to understand, how can civil society do that? And give me your experience of how it can make a difference.
Thank you, and good morning, everyone, and happy Valentine's Day. No, it's just such an important question, because you're absolutely right, and I fully agree with you. It is our voices, and it's been an honor to be invited here today under the guise of lived experience, because it's not just the voices, it's the perspective that we're adding to NCDs, in my case with type 1 diabetes. So I feel that when we bring this perspective that very few others have, it helps to move the needle. And it's a part, we play a significant part in a larger picture. But I also feel that without this, it won't complete the story, it won't take it to the end, it won't be able to do enough. It's relatively new having the introductions of people with lived experience. And I think the changes one is seeing, the fact that I'm here in that capacity in itself is a big deal. I was reading a paper not very long ago on and about type 1 diabetes, and while the paper didn't surprise me to a large extent, but the fact that the co-authors of that paper on type 1 diabetes was not just reputed doctors, but it had some of my fellow type 1 lived experience leaders on there. So when I talk about perspective, I think doing it in this manner is really helping us take it forward in a very tangible, impactful, and a meaningful way.
I think that's very, as you say, that's really changing the dial, and policymakers will have to take note when things are published, in literature. That's very interesting. Thank you for that. Let me move to, again, back to the global level in a way. Katie, from a global civil society perspective, we've got this high-level meeting. What is the significance of it? What are the opportunities posed? It's the fourth one. It's at a pivotal time, as I mentioned earlier. What do you think about that?
Well, firstly, good morning, and it's super inspiring to see so many advocates, community leaders across the NCD community here in Rwanda. So thank you all for being here. The NCD Alliance has always seen high-level meetings as key political opportunities at the global level. It was actually what brought us together 16 years ago when we were set up by the founding federations. And many in the audience know the reasons for this. These are meetings of heads of government, heads of state, highest political level, an opportunity to take NCDs beyond the health realm to the political and whole of government agenda, as well as it being an opportunity to review progress, to reset the agenda based upon where we are. And obviously it goes well beyond the actual high-level meeting and the declaration itself, because this year, 2025, is the year of NCDs. Every single government around the world will be discussing NCDs in some shape or form, a real opportunity from an advocacy perspective. At the NCD Alliance, we started very early in terms of our preparations for this high-level meeting, having learnt from 3 previous ones. You'll all be very familiar with our campaign priorities that we launched earlier last year, with the big 5 of accelerating implementation, mobilising investment, breaking down silos, delivering accountability and strengthening community engagement. And you'll all be very familiar with the call to lead that we're launching today, and hoping that everybody in this room is signing on and adding your organisation's name to that. But I think it would be remiss in one of our plenaries to not obviously address the elephant in the room, as it were. I mean, obviously the global health landscape has changed dramatically in the last three weeks or so. The Trump administration has obviously made some very reckless policy changes, with the potential withdrawal from WHO, as well as the freezing of US aid around the world. And in the short term, that is going to have a significant impact in terms of loss of lives, weakening of health systems, as well as many people losing their jobs. And that is going to have a ripple effect well beyond the main areas that US aid funds. Let's be honest, it's going to impact people living with NCDs, and it's an issue that we really need to consider as we look towards this 4th high-level meeting. I think we've got 2 options in front of us, and I think we've all been discussing this over the last few days already. One option is that we essentially crawl under the rock and say the politics is too hard, it's just going to be too difficult, let's just give up with this high-level meeting. The other alternative is, and I think this is, I hope, what we will be doing, is actually seeing it as our obligation to essentially mount the resistance against this changing world, to organise and to essentially grab this high-level meeting with both hands, because as we know, these high-level meetings don't come around very often. We're actually very fortunate in NCDs. We've had 3, and this is our 4th. But I do think it has a few kind of implications for our advocacy. Number 1, I think we absolutely have to stand up and be vocal and stay strong to our mission and our values in this changing global health landscape. And what I mean by that is continuing to advocate for people living with NCDs, continuing to advocate for equity and the marginalised populations that we serve, as well as continuing to advocate for the science and the evidence in this era of misinformation, disinformation, etc. And then the second thing, which I think Guy kind of touched upon earlier in his comments, was, there's many aspects of what we're trying to call for in this high-level meeting, which are extremely relevant to this changed global health landscape. Domestic resource mobilisation, financing. We can't shy away from talking about financing despite all of this. We need to really focus on domestic resources and health taxes, as Guy was saying earlier. These are a win-win for governments in terms of health and the economy, and it's an opportunity for governments to be really committing in a stronger way to that. I would also say that in this significantly changing landscape, really pushing for country-led, nationally-led responses that governments are really owning and leading is going to be really, really important. And another aspect I would just highlight in this kind of landscape of smaller health budgets potentially in low and middle income countries is the need to really focus on integration of care, so that we're bringing together NCDs with HIV/AIDS, women and children's health, and essentially making the money for health go a lot further and ensure that it's actually kind of oriented towards people and multi-morbidity rather than these vertical silos.
Okay, thank you, Katie. And I think that to reflect on your first part of your question, I can't see you hiding under a rock. So I think you're going to take the second option. Let me come back to Padmaja. I mean, obviously, you mention about lived experience and how important it is, but obviously you've got to get people to listen, and obviously in the high-level meeting, I'm not sure how involved people with lived experience will be. This is going to be high level. So how how can people actually get these messages to leaders, especially when things like type 1 diabetes, they have no experience themselves. Your experience and your story is maybe the first time they will have really known about it. So yes, literature is one thing, but when they're coming to think about the high-level meeting, how can voices like yours be heard?
I think the answer lies in the second part of what you said. If I feel that it's my voice that can maybe get to the leaders who may not know much about it, that should not discourage me or anyone else with this perspective or lived experience. I think we have to keep at it. Consistency is something that all of us with type 1 learn pretty early on in life. And so if we can consistently, clearly and concisely keep at it, and take up these leadership roles as and when they come. We're, of course, very, very grateful to organizations who are supporting us to be able to come forward. I think just being here will help us change some of that perspective. So no, it's not easy, but it's not impossible either.
And that phrase, of course, is meaningful involvement. And I want to bring in Guy, from a WHO level, how can there be meaningful involvement? I mean, you've at the WHO have been doing a lot of work on this, and how can that be reflected at the high-level meeting?
Yes, absolutely. WHO has stepped up and taken this the priority of operationalizing meaningful engagement, institutionalizing meaningful engagement very seriously. And I think it building on Katie and others' comments, this is a very complex current geopolitical, financial, and human rights context. And I think more than ever, we do need the voices of those on the ground, the communities, to let us know how do we adapt, pivot, contextualize some of the persistent challenges on the ground. I think we need to rely, as someone said, on the national commitments, and not necessarily at the highest level, down to community, individuals, families. How can we bring that voice to understand how do we adapt cost efficiencies, or how do we adapt interventions, how do we prioritize interventions, and that meaningful engagement opportunity of lived experience, of those living with health conditions, of those living with broader social and human and base rights experiences. How can we adapt our policies there? So WHO is for the last 2 or 3 years has been developing platforms, guidance, principles-based and action-oriented guidance on how to really implement meaningful engagement, sustain it, finance it. How do we use your example of that ripple effect? How do we ensure that that is dynamic effect across the central, person-centered, community-centered, onto the global platform and back? And that co-design interaction, that feedback loop is very alive, and we have the platforms. The lived experience has their voices that can shape and
I mean, it is a new term, broadly, meaningful engagement. And I'm wondering how, political leaders are receiving it and hearing it. Are they taking it on board? You're taking it on board, civil society is taking it on board, but how is it being received by others?
We have excellent examples at country level. We have already supported some countries in launching financially sustainable platforms for meaningful engagement of those living with health conditions in policy development at the highest level, coordination mechanisms, national coordination mechanisms, which have already incorporated and respected and sustained the voice of lived experience to shape those national policies. Excellent examples.
Well, that's good news, good to hear. I want to move on to a slightly different topic, and hopefully we've heard from Dr. Ran about global challenges like climate change, economic instability, health inequities. And I'm thinking, what challenges and what strategies should we actually use to prioritize and address these? Ferdy, I'll come to you, in Cameroon. What are the strategies that you think are working to tackle these multiple issues combined with NCDs?
So I think so far the the strategies to handle the issues on NCDs are pretty much really, really very clear. There is so much technical work that has gone into the issue of NCDs, at least before I even knew about and started working on issues of NCDs. But till date, we have so many of them. The first very obvious strategies that we need to really give lots of priority to is within the context of prevention. We have something as simple, but it sometimes really can be very complex, especially in its measurement and the level of impact it has, which is awareness creation. It's at the level of the communities, people need to be aware, but you can move that even to policymakers. In our work in Cameroon, we really find a very interesting phenomenon where those who are supposed to be in charge of doing or responding to the issues related to NCDs are not aware of certain things. I wouldn't quote names, but I would tell you how surprising it was that a leader who is supposed to be in charge of a major aspect of NCDs didn't know that there's a high-level meeting coming up in 2026, or in 2025. So this is what we mean by awareness creation, which needs to be massive to cause, to raise the dust and to cause the movement around action on NCDs. But there is other policies, you find them in the WHO best buys, that, it's a nice description, low-hanging fruit. We need to just harvest and eat. And this is what, we need to look at for action. But when it comes to downstream measures, people who already have NCDs, that's a very important area of focus. There are also things we can do immediately. I think about Pen and Pen Plus strategy by WHO. That is an amazing package. It's been worked on, it's been put in place. We need to take it up. We need to be interested in it. We need to learn about it. We need to start using it to have primary health care, to have access to care for NCDs happen, like practically. So these are some of the things I think we need to, but I think the last thing is about collaboration. We need effective collaboration at all levels. Within the national space, there needs to be collaboration. We in the Cameroon NCDs, we do experience that. But we need collaboration within the international space, effective collaboration. I really do not understand fully why President Trump is doing the things he's doing, and I don't claim to understand. But I think that within the context of effective collaboration, there can be solutions to the problems that we're facing on NCDs.
And Dr. Anne was talking about collaboration with the private sector. Does that fit into what you're including there?
Relevant private sector, please. Relevant private sector, but also within that context, I think I would say, like she said, private sector, very powerful, very, very powerful, but we, especially from the health perspective, need to be powerful, if not more, in terms of how we really sit on those tables and make sure that we get the solutions happen and save lives.
Yeah, fight fire with fire. Dr. Anne, did you want to add anything in terms of the climate change and the intersection with NCDs and strategies to actually tackle them?
Okay, climate change has not made things easier for us. Even at individual level, patients would still are complaining of hypertension. We get renal failure due to kidney stones. So even at individual level, we are feeling it. But WHO has done the hard work. We've already come up with all those interventions that you can just go and pick from and see what suits your country. You don't need to reinvent the wheel. You don't need to waste time like in deciding what to do next. These are already determined. And I think we need to be bold in implementing change. We need to initiate change as governments. And policy reforms, increase taxes on tobacco and alcohol. Make it more difficult for people to use substances. You don't have to ask for the permission. Just tell them, look, it's more costly now for you to buy a cigarette. You cannot buy a cigarette unless you have you buy it from a packet. It makes it more difficult. Multi-sectoral collaboration, yes. But what we have lacked, or what we need to do better, is a greater involvement of persons living with NCDs. So if you sit in a room and a committee, the chances are 80% of the members are living with NCDs. You either have got an NCD, or you have a family member who's got an NCD, or you know somebody close who has an NCD. This is a reality in the small island developing state. It is a small community, everybody knows everybody else. So you should be able to make decisions. If we are all living with NCDs, why can't we make decisions to improve our own health? Because it will affect our well-being in the future. So we should be able to advocate for better decisions, for reforms within our health systems. And health system strengthening, it's hard living with NCDs. It's hard for the person living with NCDs. So we need to make it easier for them. We need to make the tablets easier to take, combination therapies, health information systems, which help them with compliance, with adherence, so that it is easier for them to live fully. You know, people living with NCDs can live up to be 100 years old if they are well taken care of. So we need to understand that we need to give them that added help in the communities. Thank you.
Thanks very much indeed for that. I want to bring in Patricia now. Obviously, Katie has mentioned the high-level meeting and what needs to be done at that. But I wanted to ask you, what actions, what commitments do you want to see from global leaders in September?
I think, as Guy has said, financing is the key thing. And I think until governments really prepare to put meaningful money to the problem, I think we will continue to limp. And I think that's a drag on a forward momentum. But if I think back to 2010 and 2011, and the NCD Alliance just starting, I am astounded at how much it's grown. I am astounded at the amount of energy that is going into this all over the globe. So harnessing that energy to lobby and lobby and lobby some more. The UN seems to be such an intimidating place, but it isn't really. And you're more likely to get your 2 minutes with a government representative in the halls of the United Nations than you are in your own home country, because there are always business and priorities. Whereas in the halls of power at the UN, you can meet eye to eye. Know your subject, speak very, very briefly, but don't let them go until you've put your point across. That is the most powerful tool to bring about this kind of changes that we really need.
Thank you, Patricia. Let me bring in Papaji. I mean, obviously, in terms of that very good advice, 2 minutes, intense, with the right person. And as Patricia said, it can be intimidating, but you as a person, as an ambassador and as a founder, you've done amazing things and in India, but what would you say, going to something like that? What advice would you give to civil society people who've got the opportunity to speak with that person at that point?
I think it needs to start at the very base level for it to truly penetrate. And I think in my case with type 1, the narrative around type 1 diabetes has to change. Everything else will follow from there. And if we consider ourselves leaders in this space, then we need to be able to bring the correct information out there. There's some very senior leaders, even who have some association with the science side of it, who don't know what type 1 diabetes is. And there are many things I can say about type 1, but I feel very strongly that it's not a death sentence. So those who are newly diagnosed, or those kids who've just been diagnosed, don't write us off. And that's my simple, concise piece of information I'd like to bring forward, because unfortunately, even today in 2025, that is happening. And it's happening way more than, none of it should happen, but it's happening way more than it should, because it's the lack of awareness around it.
Yes, and of course Pen Plus, as was discussed, is doing major things in that area for people with type 1 diabetes, as I saw myself at Masoga Hospital earlier this week. Guy, very briefly, what do you want from the high-level meeting leaders? What strategies, what actions do you actually want them and commitments to make?
I have to come back to the finance. I think I have to come back to that. At the high-level meeting, we need to have heads of state at the highest level commit to addressing the gaps at primary health care access, out-of-pocket expenditures, the crippling burden of their populations that are suffering, affected, or living with NCDs and mental health. The way to do that is to take action on financing enhanced fiscal space at national level, enhanced fiscal space for health and NCDs. They have to take action. That is multi-sectoral. It requires not only health sector, very much not only health sector, it requires a cross-sectoral commitment that has to be led by the highest level. Now that requires a lot of engagement with communities and with partners, the development partners, and additional stakeholders. And I think I draw your attention again that very important international dialogue last year and very important collaboration with the World Bank and WHO. It was a very much multi-sectoral. We brought in ministries of finance, we brought in communities, we brought in member states who were already acting on some of these fiscal measures and enhancing health taxes very specifically. So I think that is the commitment. We want to see a commitment that the financing situation feeds into enhanced services for those living with NCDs, and that does require accountability.
Yeah.
So my main outcome of that is a solid accountability framework for the political declaration contained in the commitments, but also post-political declaration. We need to come together again multi-sectorally to develop a strong accountability framework.
Yeah, okay, thank you. Do you advocate ring-fenced, the money that's raised from taxes on tobacco, alcohol, etc., to be ring-fenced for NCDs? Is that it needs to be as defined as that?
Enhancing fiscal space must include enhancing health outcomes.
Yeah.
And the primary target, the primary gap in health systems is NCD and mental health services.
Yeah.
So
Okay.
it is a given that those need to be channeled into NCD and mental health services.
Thank you, Guy. So Katie, obviously, I wonder if I could ask you more specifically. You said, obviously there are two options: ignoring what's going on, or actually capitalizing on it in a way, making it show how it's even more important now to concentrate action on NCDs at the UN high-level meeting. So how can we make sure that it is a game changer for NCDs and it's not just a talking shop?
Well, I think just picking up on Patricia's point, I think first and foremost, in these times, we have to be absolutely kind of, in solidarity with each other, united and coordinated and focused. We know as a global alliance with, it's fantastic that we've got 72 national and regional NCD alliances around the world today, having, if you rewind 10 years ago to that first forum we held in Sharjah, there were 40. Such a growth. And this high-level meeting in September is obviously a global meeting, but where the rubber hits the road is obviously the national and regional level. It's every single national alliance, every single member of NCD Alliance talking to their governments and really pushing the agenda forward. And I think as much as possible, trying to stay kind of on the same page, singing from the same song sheet with our kind of headline priorities of implementation, investment, accountability, and community engagement as much as possible will have more impact with the high-level meeting, rather than all going off in our different directions, calling for our different diseases. This is an NCD high-level meeting, and I think it's really important that we're focusing on the kind of cross-cutting strategies that we're all focused on. I would say the other thing is, we need to be absolutely, this is a political meeting, and we as civil society need to be political in our approaches and strategies. And what I mean by that is obviously knocking on the door of our ministries of health. They are obviously the technical leads for this issue. But we also need to be talking to ministries of finance, ministries of trade, ministries of foreign affairs, who are really important in these high-level meetings. But also being cognizant, building on the comments earlier, that we're not the only ones knocking on their doors. It will also be the unhealthy commodity industries that are knocking on their doors. Let's be real. It will be big tobacco, it will be big alcohol, it will be big sugar, trying to undermine everything that we are trying to push. So we have to be considerate and cognizant of that in our strategies, and make sure that we've got the evidence to counter what the industry will be saying, to water down things. And let's remember, 2018, at the last high-level meeting, we also had a Trump administration, right? And at that high-level meeting, what was actually at stake was watering down the WHO best buys, the cost-effective strategies that we've all been pushing for and fighting for implementation at the country level. So we need to make sure that we're not backsliding in the NCD response as much as we're pushing things forward. And then the final thing I would say is, we're obviously all focused on the high-level meeting this year, quite rightly, and I hope everyone in this room is really focused on it at the national and regional level, as I say. But we've got to take the long view. There's not some sort of cliff edge after September where we all go home and put our feet up. It's what happens after the high-level meeting that's so important. And from, again, the national level, which is where really we need to be focusing the most, it's thinking about, what comes next? What are the kind of policy windows at the country level for you that you can be really taking these commitments at the global level down to the country level? Incorporating them into surrounding political processes. We have the G20 coming up, for example, later this year in South Africa. A health agenda is coming together, and I understand NCDs will be part of it. How can we be using these surrounding political processes that go well beyond the HLM in September to keep the momentum up?
Thank you, Katie. All right, we've got about a minute in case anyone has any comments or reflections on. I've asked you specific questions, but you may have had other points that you wanted to bring up. Ferdy, yeah.
Yeah, I just think like the high-level meeting, yes, and I agree with the fact that it's so amazing how for the length of time I've been working on NCDs, I get to meet my Minister of Health only in those meetings, but not back at home. So I think the question about our asks is very important. And for me, domestic financing, given the context and everything, is very important to get a commitment on that. I think effective collaboration is very important to get high-level commitment on that. I think community engagement is also very important. And speaking of community engagement, we're also talking about being able to go back home and effectively be able to have that engagement with our political leaders where they've committed to truly work with us. From a civil society perspective, we have needs. We have unique positions. We have needs of financing. We have needs of capacity. Even though we have capacity, we have a lot of technical capacity, but we have needs of platforms to be able to express those capacities. We have need of being listened to. That's also part of meaningful engagement of youths, of civil society, of people with lived experience. They are also citizens. We have need of those, platforms. And let me just use this opportunity to give a shout out to NCD Alliance, because I think since 2013, there is that demonstration, that modeling of capacity that the civil society needs, that they have been able to provide. The platforms like this global forum, they've been able to provide, and that's a lot of leadership that has been demonstrated. I want to give a shout out to that. And all the mentors, because we have to sustain the work, and mentorship remains key, and that remains a civil society need. And I want to give a shout out to all the mentors in the room. Thank you.
Thank you very much indeed, Ferdy. I'm sure I agree with that. Really important work being done by mentors around the world. Now, I just want to ask our panel, and I mean it in 30 seconds, just what is your one key takeaway point that you want the audience here to have when they leave the session? Guy, what's your final takeaway?
I'll go back to Patricia's visual. You visualize what we're all here for and what this is all about. This sort of ripple effect where this is concentric circles feeding into and off of each other and this feedback loop. I think that is a visualization of our discussions across the forum and in this panel. Thank you.
Thank you. I come to Dr. Ram. What's your takeaway?
We need to operate as partners. I think we need to see each other as collaborators. And I think we need to educate ourselves, educate our partners, educate the policymakers, the politicians. I think our president is leading the campaign against obesity since 2023. Educate our professionals. They also have to collaborate. It's not about communicable versus non-communicable diseases. We need to educate the press. We need to educate our practitioners. We are guilty of confusing our people with so many conflicting messages. But most of all, educate our patients, but see them as people.
Okay.
People are at the center of our interventions.
Thank you very much. Pajmaj, what about you?
When I was asked how many people I was expecting to see at the, how many people were going to be here at the conference, I responded as, I hope at least 6 million. I know that that's not the physical bodies that are going to be here, But I do hope that you can carry these messages forward and they can reach about 6 million people. It's through you that we get our points across, and it helps us in ways that you might not really know. But
Thank you very much indeed. Ferdy? Yeah.
My message would be, as an advocate, if you don't move, nothing moves. You have to be able to move as an advocate for anything to move. Don't be afraid, don't be shy. Move for things to move.
Thank you. And I'm Patricia?
I would say never take no for an answer. Make noise, focus, and simply never take no for an answer.
Yeah, I'm sure that, that's very good advice. And lobby hard is another one by not taking no. But Katie, a final word from you, just in, 4 seconds.
4 seconds.
No, you've got 30 seconds.
I mean, I think just drawing upon Sir George Lane, who's obviously one of the founding fathers of the NCD response and one of the visionaries behind actually bringing this forum together back in 2015. You know, he's always said, advocate, agitate, and communicate. And I think I would add to that, you know, be in unity and solidarity during these challenging times.
Thank you, Katie. Well, I think, we've all had lots of food for thought there ahead of this high-level meeting. What I took away was, obviously, we need data, like Anne said, but we also need the lived experience, making it, and also having meaningful involvement with people from civil society and with lived experience, making that voice heard. I'm sure you're all going to do that, and everyone's going to go back to their nations and make sure that their voices are heard to their political leaders. We have to bring that to a close. I'm afraid we're over time. I hope that the great panel have inspired you. I just got a couple of notices. There's a film screening of the NCD Alliance mini-films and a Q&A with protagonists at 10 o'clock in the community zone, so don't miss that. And the programme will start again at 10:30 with satellite sessions. But before we break, please do thank our fantastic panellists, and thank you for listening. Thank you, everyone.